Welcome back to our channel dedicated to bringing you the latest information on cutting edge medical topics. Today we are diving deep into the fascinating world of malignant pleural diseases. When it comes to diseases affecting the lungs, one condition that demands our attention is malignant pleural disease. It's a term used to describe a range of serious conditions characterized by the abnormal growth of cancerous cells in the pleural lining surrounding the lungs. Malignant pleural effusion. A malignant pleural effusion is a buildup of fluid and cancer cells that collect between the chest wall and the lung that can cause you to feel short of breath or have the chest discomfort. It is easily fairly common complication in a number of different cancers. What is the pleural space? Both of the lungs and the chest wall are aligned with the thin membranes called pleura. The lung is typically full expanded in the chest and comes right up to the chest wall. As such, the normal pleural space, the area in between the lung and the chest wall, only contains a small amount of fluid. What is pleural effusion? A pleural effusion is an abnormal buildup of fluid in the pleural space. What causes a pleural effusion? A pleural effusion can be caused by many diseases. It can be various cancers. In general, fluid may build up in the pleural space if there is no overproduction of fluid, decreased absorption of the fluid, or both. If the cause of the effusion is due to cancer cells in the fluid, the effusion is called malignant pleural effusion or MPE. The next thing is what causes malignant pleural effusion MPE to form. An MPE forms when cells from either a lung cancer or another type of cancer spread to the pleural space. These cancer cells increase the production of pleural fluid and cause decreased absorption of the fluid. Who can get a malignant pleural effusion? People with the lung cancer, breast cancer, and lymphobia are most likely to get a MPE. Mesothelioma is another common cause of MPE. Other causes of MPE included cancer that has spread from the stomach, kidney, ovaries, and colon. What are the common symptoms of malignant pleural effusion? This is the main topic. The symptom of MPE can be extremely variable and a range of having no symptoms in some people to being very bothersome in others. Below is a list of some common symptoms. Shortness of breath at rest or with their activities. Some people feel that they have short of breath while doing some work or while doing some rest. Chest pain or pressure. Sometimes the patients of the pleural face chest pain or pressure, cough, pain when taking a deep breath or feeling of not being able to take a deep satisfying breath, fever and fatigue. How do you know if you have an MPE? Your health provider may first suspect that you have an MPE on physical examination. To see if you have an MPE and estimate how much fluid is present, you will have one more of imaging test. Chest X-ray, a picture of showing a view of the chest including the heart and lung. CT scan of the chest, multiple pictures of the chest. Think of it as a set of bread loaf slices through the chest that gives a lot more detail and information that gives a lot of more detailed information than a chest x-ray. Ultrasound of the chest, one of the best method of imaging the pleural space. Ultrasound does not involve any radiation, can help used to help guide procedures or to sample the drain plane fluid. When pleural fluid effusion is suspected or confirmed, when your healthcare provider will need to take a sample of the fluid to see what causing the effusion. This can be done in two ways. Thoracentesis. This is the simple and safe procedure that is often done in an output setting. Usually, you will be sitting up and leaning over a table. The procedure is done using local anesthesia medicine to reduce any discomfort or pain. Ultrasound is often used to identify a safe place to insert a catheter. The fluid is drained over several minutes and the catheter is removed at the end of the procedure. A bandage is placed over the wound, which often closes on its own without the need for stitches. The fluid is tested to determine the cause of the effusion and look for the cancer cells. For more information, see the 80s patient information series. Thoracoscopy with a biopsy. This is a slightly more invasive procedure that is generally done for one of the several reasons. If a thoracentesis does not tell your healthcare provider the cause of the effusion, if more tissue is needed to look for the molecular markers, this will help your oncologist select the best medications to treat the cancer. To do a pleurodesis, a procedure used to get the lung to stick up to the chest wall. See below. Thoracoscopy is often referred to as a VATS, video assisted thoracoscopy surgery or medical pleuroscopy, is done under the moderate sedation or general anesthesia. Your physician will make a small incision on your side between the ribs where fluid is drained out of the space, and a camera is inserted into the chest cavity to visually examine the pleura and take a biopsy to send for analysis under the microscope. In certain cases, this can be performed as an outpatient procedure. However, your healthcare provider may want to have to stay in the hospital for at least 1 day observation. How are malignant pleural effusion treated? Medical oncologists, specialists who treat cancer, and radiation oncologists may treat the underlying cancer with the chemotherapy, immunotherapy, or radiation to prevent the fluid when accumulating. Your lung doctor or thoracic surgeon will work with the oncology team to discuss several other treatments currently available to remove the fluid and or prevent form of accumulating with the goal of keeping your breathing well. Your healthcare providers will work together to both treat the cancer and treat your symptoms. Thoracentesis. The same procedure described above can be used to drain the fluid completely. Pleurodesis. This is the procedure where a chemical is instilled into chest cavity after the pleural fluid has been drained to help the lung to stick up to the chest wall and reduce the risk of new build up of fluid. This procedure can be done either by placing a small catheter between the ribs into the fluid and instilling a chemical through the tube, or by thoracoscopy as described above, and spraying the chemical onto inside the chest will be pleural space. You will need to stay in the hospital with a chest tube in place for few days. The main advantage of this approach is to hopefully prevent future fluid buildup. You may have a temporary drop in your oxygen level. You may need medicine for some pain for a few days. Individual pleural catheter. This device is a small catheter that is placed under your skin into the pleural fluid. The catheter is safe, easy to use, and may help allow the lung to eventually expand fully up to the chest wall. Once the fluid buildup resolves, the catheter can be removed in many patients after 2 to 3 months. The main disadvantage of IPC is the need to care for the catheter. For more information, see the ATS Patient Information Secretary series perfect sheet on indwelling pleural catheters. And here is the full aspect of the malignant pleural effusion and the common complications in some form of cancer. If you have breathing problem with a cancer, talk to your healthcare provider to see if you have developed a MPE. Your cancer specialist will help you decide what the best approach may be for you to treat the symptoms of MPE and decrease the chance for it coming back. For more informative videos, follow up and keeps the thumbs up. Follow us on follow us and subscribe our YouTube channel for more informative videos. See you in the next video. Bye bye.